A hospital bed by itself doesn't save lives. A bed without doctors, a bed without serious nurses on duty, a bed without oxygen, medicines, and healthcare equipment is just a furniture for all you know. Just think about that. So when a hospital says no bed, what they are often saying or actually saying is, we do not currently have the capacity to keep you alive. Ladies and gentlemen, something is happening in Ghana recently, but this is not new. It is something we have been battling with. It looks like of late, if you are visiting the government hospital, make sure to have a parking list. Get your clothes, get your toiletries, but more importantly, get your mattress or carry your bed if you can, because if you are being rushed, especially in emergency cases, into a hospital today, don't be surprised if the real emergency doesn't become your injury or your disease or whatever you send to the hospital. The real emergency becomes a bed that you lie on. Ghanaians have given it a name, and it's casual, almost affectionate. That's the name you give to something that has stayed around for a very long time. The no bed syndrome. And I think it's time that word goes out of the healthcare system. Think about that. A phrase that should never have existed has become a part of our healthcare system. For me, that phrase is like a death sentence to a dying person from the healthcare system. And this isn't new, just like I have said. It's not rare. But you see, it only becomes national news or a national conversation when the person who is involved is somehow famous or influential or has some backing or knows someone. You know, that is telling you that a lot of people are losing their lives through this means. But we only get to hear when it's a famous person or maybe somebody that has a little bit of backing. Now, hear me out on this. The no bed, that phrase alone, for me, doesn't always seem to mean there isn't a mattress or a bed, as in a wooden bed or a metal bed or the bed that you can think of. It is actually something that even some of these health professionals themselves have explained, that it could mean that no ICU space available, no oxygen available, no blood available, no ventilator, no anesthetist on duty, no surgeon available, no functioning theater, or simply a negligent nurse and a hospital staff. In other words, a hospital bed by itself doesn't save lives. A bed without doctors, a bed without serious nurses on duty, a bed without oxygen, medicines, and healthcare equipment is just a furniture for all you know. Just think about that. So when a hospital says no bed, what they are often saying or actually saying is, we do not currently have the capacity to keep you alive. And that should worry every Ghanaian, because then the conversation is not about the absence of a metal or a wooden bed or a mattress, but a systematic problem that we should look at. Ladies and gentlemen, this crisis didn't begin yesterday. We have records. You see, in 2018, a 70-year-old man was reportedly turned away by 7 different hospitals before eventually dying at Lekma Hospital. The records are there. So this became a public outrage, and the government made investigations. And you know what? The inquiry found that some hospitals that turned this man off actually had empty beds. Ladies and gentlemen, think about it. What does this tell you? Doesn't it seem like the actual problem is not the bed, but something that we are overlooking? So yeah, fast forward 8 years, February 2026, another issue. 29-year-old engineer Charles Amissah, wherever he is, may God keep his soul, and a condolence to his family once again. He survives a motor accident, but you see, he couldn't survive the poor system, and it was the poor system that crushed him. And when I read the recommendation from that report, it sounds painfully familiar, and almost the same conversation Ghana have been having over the years, just that it's with different victims. Today, we have another sad reality again, one that many Ghanaians couldn't ignore. Our celebrity, Mzbel, emotionally came to her social media and announced that her 46-year-old sister had allegedly died after being turned away because there is no bed available. This is just a small fraction of the whole thing, because there are a lot of people losing their lives because of this no bed syndrome. Ladies and gentlemen, here is the part of my observation, and I have looked at some studies done by other researchers. You see, for all you can debate it. I don't have a problem about that, okay? But this is what I found. You see, Healthcare Workers Association have repeatedly argued that many hospitals are overstretched, they are under-resourced, and they are actually right about this. But this is only one side of the story. The actual problem is the professional irresponsibility. Ladies and gentlemen, take note, the professional irresponsibility. Ladies and gentlemen, this is the major issue causing loss of lives, and we have put it in the no bed syndrome category. For all you care to know, emergency medicine exists for one purpose: to stabilize life first. You see, paperwork can wait. Listen to this carefully. The long processes of verification can wait when a life is at stake, because life cannot wait. And I find that system failure and individual negligence are not mutually exclusive. Sometimes both exist at the same time, and both deserve attention. And here is what frustrates me the most: every major no bed case produces another committee. There's another investigation that will go on, another report, another set of recommendations. And ladies and gentlemen, these recommendations doesn't save the next life, for all you care to know. And here's my proposal, because it seems something is not working. If not anything, let's start with this. If anyone can share with the Ministry of Health or the appropriate authorities, it will be great. Because imagine if every major hospital in Ghana was connected to one real-time national emergency dashboard. The moment an ambulance picked up a patient, that is not the point where it will be doing try and error. It would already know which hospital had ICU space, which hospital has oxygen, which hospital has blood, which hospital has whatever that they would need to treat whatever condition that they have picked up. No guessing, no driving from one gate to the other gate. Ladies and gentlemen, this can work because the technology already exists for this, and we can copy blueprints from other countries that have this available. A person in an emergency situation can't hold on to every minute. I have learned that in emergency medicine, minutes are not just minutes, they are survival. So when I hear no bed syndrome, or when I hear the phrase no bed, the picture posed to me is a dying person rushed to the hospital only for the healthcare system to clock a gun and fire them multiple times in their head to send them to an early grave. That's how serious this is. And yeah, I have always waited to see how the Lord deals with those involved. Thank you so much for watching me. If this conversation made you think, then don't just scroll away. subscribe and share it.